the Aesthetic Podcast from Local Women magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast. I'm Emma Heaney and today I'm joined by Dr Dean St Mart. Today we're going to talk about ageing, but also we're going to touch on GLP-1s because they are everywhere, aren't they?
Absolutely.
Yeah, so there's been a massive surge in the interest of GLP-1s with the weight loss drugs such as Ozempic, Wegovy, Mounjaro, and there's other ones coming out quite in America already. I think it's really important. It's great that we can lose weight with them, but losing weight too fast and the impact on aging, can we discuss that?
Yeah, GLP-1s, I've discussed with you before, they're diabetic medication that I guess serendipitously they found that the diabetic patients who were getting this medication were losing rapid amounts of body weight because their appetite just became non-existent. Mm-hmm. And so one of the first ones that was then repurposed, semaglutide, became from Ozempic to Wegovy. And how, I guess, they impact our overall body's metabolism and the aspect of anti-aging is that we are perhaps putting less stress on our body from a lack of nutrient intake. So you have, I guess, two processes in your body. At one point, you're either building new cells, or on the other side, you're repairing and getting rid of dead cells or bad cells from your body. And if we're constantly eating and eating and eating, we're triggering the switches for build, and not enough of repair and clear away. That if we have periods of calorie restriction, whether that's fasting, from nutritional habits, or from these GLPs basically telling your brain that your stomach is full, you're giving the body then a chance of energy restriction to get rid of all the, I guess, aged cells from your body, the dead cells. As we get older, our cells basically are dividing all the time to create new ones from them. That at one point, the cell's DNA of what helps create all of our cells in our body, all the information, can become dysfunctional. So it gets to a point where it gets damaged. And the cell has two choices. Your body will either see that that is a cell that can no longer replicate or do its function and gets rid of it, cleans it away, and a new cell takes its place. Or it becomes senescent, or what they call like a zombie cell. A good example from an aging perspective would be grey hairs or white hairs, in that the melanin cells of your hair follicle have basically lost their ability to replicate and produce colour pigment. It's not that the cell isn't capable of existing, it's just it's lost its ability to make that pigment and basically become a zombie cell. It exists, but really our body should see it as dysfunctional and remove it. So as we get older, the likelihood for these senescent cells increases throughout our body. And really what we should be doing is clearing them away. But if we don't, then they produce messengers that are inflammatory. And this is quite often why when, like especially guys, if they get a grey hair in their beard, all of a sudden there's a patch of grey hairs because that one zombie cell affects all the other ones around it and they become zombies. That this aspect of aging, this senescence, if we can stop this from happening in our body, in theory our cells can live a much longer life, or in theory we could live indefinitely. So if we look at how GLPs play into that, if we are constantly giving our body these fed signals all the time, and perhaps we're not giving it the right nutrition, so the mitochondria that make your energy also are the biggest polluters of your body. So when your mitochondria make energy from food, they create oxidants that damage your body, and those oxidants are cleaned away with antioxidants. So if we don't have enough antioxidants, whether that's from our body's ability to make them or from our nutrition, those oxidants can start damaging our cells, which again contributes to that aging or senescence. That being able to reduce our calorie intake, perhaps focus more then on healthier eating habits or healthier eating choices, again, to build into that antioxidant intake, that we're perhaps prolonging our length of life. Again, oxidative stress, not having enough antioxidants can play into a whole host of problems. Cardiovascular disease probably being the one at the very, very top from a longevity perspective. So when we use these medications, they can be useful, obviously, from an anti-obesity perspective.
Absolutely, yeah.
But, and we discussed this before, that they serve a purpose to basically cut off the connection between your brain and your stomach. So your brain basically is told, I'm full, I don't want any food, which can be very useful for someone who has food focus, who's constantly focused thoughts around food and food intake, that now they have a better handle to get rid of that white noise where they're just looking for snacking and everything else, taking a more structured routine of eating. The other side of it then, I guess, that follows from that is the improvements to their metabolism. Again, they're a diabetic medication, so improves their insulin sensitivity, how their pancreas works, which again has knock-on effects to your overall aging of the body. Glucose and iron are probably the two main things in our body that actually damage our cells when they're in excess. So again, a lot of our antioxidants will combat too much glucose and too much iron in our bloodstream to stop us aging. So if we view what these medications can do in the short term, it can allow someone to get a grasp on dietary patterns. But in the long term, when we look at the clinical trials that focused on these compounds as weight loss agents, whilst a lot of the participants in the clinical trials lost up to 2/3 of the unwanted body weight within the year to year and a half trial period, close to 1/3 of them only kept the weight off, and the rest regained quite a significant amount of what they had lost. Which then tells us that once we remove that crutch of removing this white noise of focusing on food all the time, that they fall back into these habits and routines that were there in the beginning. And again, that feeds into potentially a cycle of what you might observe in someone with like binging and dieting phases, where they binge and then they go on a diet and they binge, that there's no coming in and addressing how to build a more structured routine of food intake or food habits. That it's very important when someone looks at these compounds from either an anti-aging perspective for the calorie restriction part, or from an obesity or body weight reduction, that the routines of how we feed into foods and food culture are addressed at like the core.
Yeah, we do a weight loss clinic at an Elite, and we have where you have your nutritional support as well as your relationship with food, lifestyle changes. It's a whole package. I mean, the pen will do, or the drug will do what it needs to do, but there's a lot more to it afterwards. And like you say, it's changing that lifestyle. It's a help, it's an assistance, but it won't do it all for you. And I think what we've noticed as well is there's a lot of muscle loss, so we want to maintain their muscle mass.
Absolutely.
Yeah.
And I was just about to say that we become very focused on body weight reduction. And body weight basically just means you reduce the number on the scale.
Yeah.
And really, yes, that's a good indicator that you're losing body mass. But that body mass you're looking to lose is, in theory, unhealthy fat from the body, whether that is visceral fat around the organs or a high amount of what you'd consider inflammatory fat. Not necessarily, someone could have high amounts of sub-Q fat, so on their skin, which might not necessarily play into a metabolic risk to speak. Obviously, as body weight goes up, then you have an increased risk of high blood pressure and high resting heart rate and everything else that plays into that. But the internal sort of inflammatory fat around our organs, which then of themselves create more inflammation through the body and oxidative stress, is what we're looking to reduce. Muscle is probably our most valuable, I guess, body part, if you want to call it that it's our our main producer of quite a lot of our energy, or the utilizer of a lot of our energy. And so when we're looking to reduce body weight, we want to lose body fat, but also maintain lean muscle mass. And that's where often the approach with a GLP is combined with resistance training, so training the gym with weights to stimulate the muscle fibers to stay as they are. If you don't use it, you lose it. But also a good centered relationship around protein feeding first. So the majority of your meals focus them on protein. So you're feeding your muscle cells the building blocks of what they're looking for, and then making up the rest of your appetite with, I guess, what your body preferentially likes to use, whether that is glucose from carbs or fatty acids from fats. But having that protein feeding first at the forefront and making sure that we're roughly aiming like the minimum intake for protein retention is somewhere around 1 gram per pound body weight. When we look at kilograms, it's somewhere around 0.6 to 0.8 grams per kilogram. That if we're again looking at focused on keeping our body healthy, keeping muscular strength, if we don't feed the body protein, it'll basically break down muscle mass for energy. It'll break down protein for energy.
And a lot of the questions I would get is, Emma, I can't eat that amount of protein. So I know that they would take protein drinks and protein bars. What's your thoughts on them? Or
yeah, I mean, they just serve a purpose as a food source. Again, we have to look at something like a whey protein shake, which is basically just a byproduct of milk manufacturing. I guess in the past there might have been a stigma around protein shakes and the gym culture and all that. But I remember having a conversation one time with a nurse about protein shakes, and one of the things that she said to me was, because she knew my background with supplementation, that she said, "What's your thoughts on protein supplements for like a 16 or 18-year-old training in sport?" And I said, well, if they're not getting enough in through nutrition, then it can be a useful strategy. And her reply was, I don't really believe in it. And this was a health nurse for pediatrics. And I said, well, you do know the main ingredient in child's formula is whey protein when you look at baby formula. And then that sort of clicked in her head of, oh gosh, like I'm telling people to use baby formula, but protein shakes aren't healthy. That they are definitely something that if someone can't stomach looking at a chicken breast to eat, again, when we have what we visually see and what our internal, I guess, stomach dynamics are telling us from an appetite perspective of, I don't really want to eat this food. Drinking a protein shake serves two purposes. You're getting the protein, but you're also getting the hydration.
Yeah.
Because that is a big thing that does occur with these medications as well as chronic dehydration, the fatigue that can come from it, the muscular strain, because not only do you forget to eat, you also forget to potentially drink.
Yes, because you have no desire, And I think as well, from my perspective, then they're coming to me with crepey skin, fine lines, loss of muscle tone. We talk about the Ozempic face, so while, we have treatments that can address that, I think we can look at anti-aging from a supplementary point of view as well. I mean, we all work together in synergy, I feel.
Yeah.
You did a very, very good podcast on oxidative stress and amino acids. Wasn't that correct?
Yeah.
And what's your secret to anti-aging?
Oh, God.
And don't put me out of business.
I guess, like, when we look at oxidative stress, I hinted to it that it's basically an imbalance between what's going on internally in the body from an oxidation perspective. And oxidation just basically means oxygen reacting with things. And then what our body's defense mechanism is against that pollutant. So that could be free radical formation. We all hear about free radicals where it's like from the sun aging our skin. That is free radical formation. And that free radical, like take our skin, for example, we have the collagen cells of our skin. If the mitochondria of the collagen cells of our skin become dysfunctional and they lose their elasticity, you start to see obviously lines form, wrinkles form, or you'll see loss of hydration to the collagen. So again, the skin can sort of sag, it loses that firmness. And that's where obviously we put sun cream on our skin to protect it against ultraviolet radiation causing that oxidative stress to our skin. I often find it interesting that if we look at even sunburn is an artifact of oxidative stress. So if someone is getting excessively sunburnt, and if you go on holiday and you see like the guys that turn into red lobsters within a day or two, that is a signal of the internal oxidative balance of their body, that of course we're going to burn from exposure to UV sunlight, and that tan is a defense mechanism. Our skin becomes darker to help stop the penetration of the UV light through our skin. If someone is having very bad sunburn, even with sun protection, it's because of that underlying oxidative stress. And they've done studies surrounding this with, balanced omega-3 and omega-6 intakes. So you're looking at your good fats and your bad fats, to speak, in your diet, and the index of the skin burning. And those who have a higher omega-3 intake versus omega-6 tend to not burn as badly as those who have a higher, what's called inflammatory fat level in their cells. So looking at aging then, the two main oxidants of our body, like I said, is iron and glucose. Iron tends to be genetic to an extent, that those who have hemochromatosis and high iron are at big risk of health dysfunction because that iron is damaging all their tissues and getting stuck, but also because your body's main antioxidant, glutathione, is what helps get rid of iron out of your body. So you then run into issues where you're not making enough glutathione, and then you're not able to protect your body against other things that are going on around it. Elevated glucose, again, we have a defense mechanism where we'll put glucose onto our red blood cells in order to protect them. And people might have heard about glycation as a thing that causes skin aging, where we've glycated the skin, and that's sticking sugar onto a protein. So collagen is a protein, so you can glycate the collagen, which makes it dysfunctional, which again contributes to an aged collagen production or aged collagen within our skin. Now, looking at how we're utilizing glucose, we're eating too much, have we lost our insulin sensitivity, how well are the pancreas operating, and you might be able to give that a bit of help with the GLPs that we spoke about. But maybe we need to look at our diets, our intake of antioxidants and polyphenols, whether they're like looking at green tea, grapeseed extract, grapefruit, vitamin E. Vitamin E is probably our, next to glutathione, our main protector of our cells.
Right.
And a lot of people would take vitamin E as a supplement for skin health and as an antioxidant. But the unfortunate thing is that it's never really spoken about that vitamin E is generally only sold as one form. It's normally gamma tocopherol or alpha tocopherol, which is only one out of the 8 different molecules that make up the vitamin E family. So if you're looking to improve your vitamin E status of your body, it's important that you're getting what are called the tocotrienols rather than the tocopherols. The tocotrienols are the active vitamin E molecules. So a food source that would be very rich in tocotrienols would be red palm fruit oil. So you can, if you go to a local supermarket, you'll see red palm fruit oil as a cooking oil or something you can put in your food, or you can look for supplements that have red palm fruit in it and all the forms of vitamin E.
Does a supplement do they have a anti-aging supplement?
What I made was what's called the Heart Stack.
The Heart Stack.
And the Heart Stack basically was all these polyphenol and antioxidant rich ingredients that, yes, help lower heart disease risk, but at its core, heart disease or atherosclerosis is really driven by oxidative stress. We had this hyper focus on cholesterol
Massive.
being the driver of heart disease, that when we look at medication support for cardiovascular disease and more so blocking cholesterol, the absolute risk reduction of taking something like a statin becomes around 3%. So for every 3 people taking a statin out of 100, they're not going to suffer a heart attack. The rest will. And then you start working your way back down the chain, that reducing cholesterol is very important, because the more cholesterol particles you make, the higher the probability of them being oxidized and damaged. So when someone is taking a statin and they reduce their cholesterol value, but they're still oxidizing it at the same level as if they had a higher cholesterol number, they're just buying time as opposed to getting rid of the problem. And that's where it's important then that if someone is looking at high cholesterol as a risk factor, reducing oxidative stress of the body is absolutely critical to offset what the cholesterol can do.
Right. So your heart stack technically is your anti-aging.
You've got Evenol, which is a trademarked, patented form of all 8 vitamin E molecules in it. So again, if someone wants to look for Evenol as an ingredient you can buy separately, the way we sort of view things with supplement needs is we've put as many ingredients into the one product to the same standard dose of what would be in one tub. So I often joke Heart Stack is 15 ingredients in one tub, which is basically 15 tubs out on your table.
Yeah. And my cupboard at the minute is full. So Heart Stack and Sleep Stack, they're on my shopping list. From an anti-aging perspective, we talk a lot about collagen and collagen supplements. Is it better in a tablet form or a fluid form or for absorption?
Not to our knowledge yet.
Right.
Collagen synthesis and collagen formation from supplements is within a very early point of research. Even though it's been around about 10, 12 years as a dietary supplement, on one side you've got a lot of skeptic researchers that dismiss collagen, that if you have collagen as a supplement, it doesn't directly improve the collagen of your skin. But that's a very naive way of viewing it, because when you take collagen, you're taking it for the peptides or the amino acid chains in the collagen protein to be absorbed into your bloodstream to then get transported and stored in your collagen matrix. So it's not that the collagen itself is the magic thing. It's what's within the collagen peptides, and how they're transported from the gut into your body. And that's where there was some research showing that vitamin C is very important for the absorption of collagen into your gut, into your bloodstream. That if you are taking a collagen supplement, where that is bovine or marine-based collagen, a lot of people have moved more towards marine because it's a more ethical way of getting collagen, which is important also because vegans often think that there is no form of collagen for them, but there actually is. There is a vegan type of, I guess, organic collagen where they've put the amino acids together in roughly the same peptide formation as what would be in marine or bovine. So if someone is vegan, there are vegan-based collagens that, taking it with vitamin C, helps with that absorption. And whether you choose bovine or marine, it's more so down to the actual different types of collagen. So you've got type 1, type 2, and type 3. Most of the supplements out there focus on type 1, and the research for skin health tends to focus on type 1 collagen.
Also as well, you talked there about longevity. I'm just going to bring you back on that because there's been a lot of talk about NAD and NAD+. What's your thoughts?
Very useful. Again, we had a nice conversation about mitochondria and energy production and magnesium supplementation. What basically NAD is to our body is a donor of electrons that help the mitochondria to work properly to make energy. So when we might have a deficiency of NAD in our body, the most simplest thing to go back to is NAD nicotinamide dinucleotide. is made from nicotinic acid, which is vitamin B3. So one of the easiest ways to get your body producing your own NAD is to look at your vitamin B3 intake. When we use NAD as an infusion or an injectable, what we have to be mindful of, and this is what I sort of love when we get this big hype around an ingredient like NAD or NMN.
Yeah.
NMN is the oral form that helps to produce NAD in your body. That within your mitochondria where you're making the energy are these 5 complexes. One of them uses NAD and then it feeds off to the other 4. If you give the body a big burst of NAD, you make complex 1 work better, and then everything after that has to keep up. Complex 2 uses FAD, which is another like energy creator, and FAD comes from vitamin B2. So if you give your body a big source of NAD from an injectable protocol or supplementation, you have to be certain then that NAD can be recycled properly to keep it going. Because you're going to get this big burst of cellular metabolism or cellular energy. Your mitochondria are producing all this energy that can be fed into processes of your body or daily energy for movement, that over time you might actually be causing some level of dysfunction if the other things aren't being supported. Mm-hmm. So it's important, like when people see these things, that they on the surface they work amazingly well.
Yeah.
But there is, I guess, not a price to pay, but you have to understand that if I do this route of improving my cells working, there's all these other things that have to feed in. So make sure I get enough vitamin B2, vitamin B9, folate, B12, the glutathione, because again, once you start making a lot of energy, your mitochondria create pollutants themselves. And one of the biggest pollutants our mitochondria make is hydrogen peroxide.
Right.
So if we look at aging, whilst I touched on like grey hairs of our, like at the beard turning grey because the melanin can no longer make the colour, acute oxidative stress can present itself as a white hair. You basically created hydrogen peroxide, which has bleached your hair colour. So you can also see if someone is very, very like acutely stressed with a high amount of oxidative stress, like white hair formation is basically bleached the hair, as opposed to what you've caused is cell aging. So that's another indicator of like your oxidative stress balance, is that sometimes you can reverse white hairs if they're coming from this underlying dysfunction of not getting enough antioxidants, as opposed to the cell being, I guess, aged and lost the ability.
So you're saying we can reverse aging?
Well, I think long term, it's you know, one of the biggest things that they're focusing now for longevity is to view aging as its own disease, as opposed to being a consequence of diseases in the body. And being able to preserve our cells replicating for as long as possible. Because I guess by definition, humans have put a limit on their lifespan, thinking that we can only live to 80 or we can only live to 90. Whereas, you know, 100 years ago, we were only living to 35 or 40. And then everything, advancements in medicines and combating environmental stress like bacterial infections, hygiene and everything else, we've expanded our lifespan. We then developed medicines to offset diabetes, cardiovascular disease, food quality improved. And that sort of has brought us into our 80s and 90s, that if we can now start focusing in on the mitochondria and the oxidative stress, I think the next road map for humans is to get to 120 or 130. And then from there, look at, I guess, the ability of stem cells being able to replace our body with. As we age, we run out of the ability to keep repairing things because our stem cell pool gets depleted. If we can start seeding bioidentical stem cells into our body, in theory, you could probably live forever, provided the underlying chemistries continue to support. It's an incredible thing to think about. Whether you want to live forever or not, I don't know.
The jury's out on that one at the moment. I've just been, like I said to you on the last podcast, I let people know I was going to interview today. And so I said, what questions would you like me to ask? Because you are an absolute fountain of knowledge. And as I say, some of them I'll have to ask you off air, can't ask you on. But there was one we've done about the NAD, but also the other one about what's the role does inflammation play in the aging process, and can we reduce it naturally? Now, I know we kind of covered that in our health podcast, but just sort of like a synopsis of how do we keep the inflammatory markers down?
Absolutely. I mean, inflammation at one point was a very buzzword where everything was blamed on inflammation. And inflammation really at its root cause is our immune system. Our immune system are reacting to something that is annoying them. And so when we see a threat in the body, whether that is a bacteria, whether it is our own cells, we produce these inflammatory messengers, cytokines, which then tell either other cells of the immune system or tells our liver that there's a problem going on somewhere. So one of the main things on blood work that we look for from an inflammation perspective is C-reactive protein. So C-reactive protein is made by your liver to hunt down and remove a source of inflammation. But it's only produced when the liver is constantly being told inflammatory messages. So if you keep making these cytokines, eventually the liver goes, okay, there's something not right. I need to send out C-reactive protein to see what needs to be resolved. C-reactive protein, you can have a high sensitivity check. So most of regular blood checks of C-reactive protein won't go below 1 from a decimal perspective. And so either you have a value above 1 or a value below 1. The high sensitivity check can go down to 0.1 as a sensitivity check. That anything above 0.5 for high sensitivity C-reactive protein is telling you something is inflamed in your body. Now, interestingly, for most people, having a small amount of inflammation, it tends to be normal, if you want to put it that way. And it's quite often our gums. So when you see C-reactive protein or high sensitivity C-reactive protein below 1 but above 0.5, it's normally a sign that there's either inflammation in the gums or there's been some acute stressor that the immune system has had to deal with. And again, from a longevity perspective, seeing the hygienist from a gum health perspective and keeping that inflammation down is vitally important. Then, I guess below that, looking at environmental triggers of inflammation, what would make the immune system get annoyed? And it tends to be the gut. The gut then is sort of your gateway into either letting nutrients into the body to be utilized to repair cells, or might allow bacterial toxins that are naturally made by our gut bacteria into our bloodstream, which can trigger off an inflammatory response. When we're looking at lowering inflammation, it's normally a combination of using, I guess, different types of herbs. Curcumin or turmeric tends to be the main one that's sort of viewed as an anti-inflammatory. What that tends to do is it helps to lower that cytokine production. So we see that C-reactive protein value fall. I guess the thing that we have to view about inflammation is, on one side it's damaging, but on the other side it's a positive thing in that it tells our body there's something going wrong. So if we have, let's say someone has their C-reactive protein and consistently it's always above 1, but not massively high. Like if someone has a flu or an infection, C-reactive protein's in the 10s, 20s, 30s. Let's say that C-reactive protein's around 2 or 3 all the time. It's normally a sign either that the gut is inflamed or the arteries are inflamed. Taking a supplement to lower inflammation or lower that inflammatory messaging is a useful thing. But if you're not addressing the underlying dysfunction of what's causing the inflammation, you're just doing exactly what I would not want to do, and that's just mask the problem.
Yeah.
So inflammation, I guess the other thing that contributes to inflammation in our body is visceral fat that we spoke about. And to the point now that fat itself is now being viewed as an endocrine organ that actually has its own hormone signaling and produces adipokines or fat signaling messengers. And they of themselves are inflammatory. They start to create inflammation in other cells around them. So if we go back to like the GLPs, reducing that adipokine production, again, what we might find might increase the number of fat cells is too much estrogen. If there's an estrogen imbalance, it can help with fat cell proliferation, which then feeds into more inflammation. So it's a very interesting area, but there's not just one like supplement or way to address it without thinking about what's triggering, what's annoying the immune system to have to respond to the inflammation.
Yeah. So if the listeners want to get in touch with you, you're happy enough that they contact you via your email or via Instagram?
Correct.
Because I'm sure that this has sparked a lot of questions for people. You are Dr. Dean
Dean STM.
DSTM on Instagram. And thank you so much. I could talk to you all day. We might get you back for another session, but on this occasion, I probably have to wind up on the anti-aging. You're not going to put me out of business completely, because if you live to 120, you're definitely going to need my services.
Absolutely.
And thank you so much.
It's been a pleasure. Thank you, Emma.
Thank you.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.